Hi everyone, you're welcome to the month of June, which is a Sickle Cell Awareness Month, and we St. John's Hospital would like to talk to you about what sickle cell disease is, how one could even identify or be able to diagnose himself or herself that he or she is having a sickle cell disease, and also how much impact this sickle cell disease will have on you and also on your family. The common myth that is in the society, and I'd like to clear them up. People think that sickle cell disease is a disease that could be infected in a way. So it means that when you get in touch with someone, the person having sickle cell disease could let you also have the disorder. But that is not so. And also, people think sickle cell disease affects some particular group of people, or they have peculiar features that make them prone to developing the disease, which is also not so. Sickle cell disease, like we know, is an inherited condition, meaning your father and your mother contribute to you developing the sickle cell disease. So if your mother have a genotype like AS and your father has a genotype like AC, the chances of you developing sickle cell disease is almost about 50%. And this makes it more likely that when you are getting married, you need to know your partner's genotype. So you could prevent the child from having the disorder called sickle cell disease. Well, there are so many things that you could find on yourself or you could actually look up when you probably growing up and you realize that you're falling sick quite often. That could probably let you know that you need to get tested whether you have sickle cell disease. Commonly, people with sickle cell disease may not really have any features on their skin or on their body for you to even think this person might have the disorder. Others too also may have features like frontal bursting, which or they have something we call natopathy. That people or identifying or seeing people with these features will actually make you think that they may have the disorder called sickle cell disease. Commonly, others may keep on complaining that they have pains either in their joints or in their limbs or sometimes within their chest region or the abdomen. This could also make you think that the person may have sickle cell disease. It can never be certain with just the features. Always a blood test has to be done to really confirm the person has sickle cell. You may ask, can I prevent or can I treat this disease if I have one? Well, when you have sickle cell disease, it's actually a chronic disease in that this disease may be with you for like your lifetime. And so that's why it's quite important for you to really decide early when you're getting married to know to know the genotype of your partner and also yourself, so you can prevent your child from having this disorder. If one gets sickle cell disease or one gets to know that he or she has sickle cell disease, it's quite important that you get enrolled in a hospital where a follow-up could be done for you. And there are so many remedies or there are so many treatments available now. At this point, I would like to invite one of the people who have been living with sickle cell disease for the past 20 years. And it will intrigue you how they have been able to survive, how they've been able to cope with the social pressure from this disease, how their family have been so supportive over the period. And so we invite Petra, who is about 24 years old, and I would like her to share much experience about the disease and how she's been able to cope over the period. Hi, Petra. You're welcome. All right, I'm happy to see you today. I hope you're doing well. All right. So, I understand a lot of things that have gone over the years to do with sickle cell disease. So I'd like to know, when did you even go to know you had sickle cell disease?
I literally didn't know I had SS. In my childhood, I was very fine. I was very okay. Nothing was wrong with me till I got to SS. I felt sick, severe chest pain, leg pain. So they rushed me to the hospital. And then the doctors didn't know what was literally wrong with me. So they were suspecting it was either rheumatism or SS. So they transferred me to sickle cell. And then in that case, we did a test and then got to know I was sickle cell patient.
Yeah, well, that might be very disturbing. So how did your family take it then? I would like to know how this disease has really affected you when it comes to your physical being. I mean, in terms of your activities, in terms of going out, in terms of walking, in terms of having to exercise and even go out to have fun. How has it affected you physically?
In terms of physical, it has affected me a lot. I can't walk really well. When I walk, I'm in pain. I can't go out a lot. I'm always in pain, always in the house alone because there's no way I can exercise. There's no way I can walk for like 5 minutes and then not being in pain. There's no way I can play football or play and be like others. yeah, just really affected me very much.
Yeah, well, so additionally, I would like to know when it comes to how you feel, like emotionally. I mean, knowing the fact that you have a condition which you cannot take a medicine to just treat it, and also knowing the fact that there is really nothing you can do about it. All that you have to do is to probably go to the hospital when you are not well, and sometimes probably taking medications to prevent complications from coming in. How has it affected you emotionally too?
Sometimes I feel depressed. Sometimes I think a lot, doing something bad to myself. Sometimes I just wish it will end, and then like all the pain will just go away, everything will just be normal. But then it's not like that. Sometimes too, I think that when I'm not there anymore, my parents won't suffer with pain of bills and all that.
I'm just looking at the fact that having to deal with a condition which it wasn't something you brought it on yourself, but this is something that you just inherited from your parents in a way. And probably out of ignorance, they did not really know they had some genes which were already mutated that could result in having a very beautiful girl like you and a beautiful girl like you having a condition which you cannot really do much about. I don't know if at your age, how is this really affecting your relationship wise? Are you able to really date? Are you able to go out with your friends? And how many boys have even or guys have even come into your life and probably realized that you had this disorder and how did they even take it?
In terms of relationship, it has really affected me because when guys come to you and then they get to know you have sickle cell, they just run away because they sometimes think that is a burden to them because you're always going to the hospital, you're always in pain. And sometimes when I ask my friends, guy friends, they always tell me that no, with someone with a sickle cell, no, we can't date them because they always have to spend money on them. They always have to go to the hospital.
I mean, I thought love conquers all. So when I love someone, I should probably be willing to support them no matter the situation they are in. But this can really affect who you really date. This can really affect how you even take the next step in your life. So this is a young woman who has everything. Like physically, she looks beautiful. Physically, she has all the body. I'm sure a lot of men will be admired. But when the person realizes he or she has a sickle cell disease, he may not be interested to be with her. It's really sad. So I also want to know how it has affected your family in terms of finances, in terms of the support that you get from them. How has it affected them?
In terms of finance, it has really affected them because all the time they have to pay something. They had to buy medicine for me. They had to take me to the hospital. Sometimes my mom will be sitting there very quiet thinking, and then in my head I'm thinking that she's thinking because of me. Probably she has to go and buy a medicine and there's no money at that time and then I need the medicine to it really has affected my family.
Okay, lastly, I would like to know what kind of advice you will give to our viewers today.
The advice I'll give to my viewers today is that firstly, when you are getting into a relationship or when you are getting married, you should first know your partner's genotype. Secondly, when you get to know that your child is is having SS, please family be supportive so that they won't do anything bad to themselves.
Thank you. Thank you very much for being here today, and we hope that you'll be able to take care of yourself well, do all the necessary follow-up you need to do in the hospital. And as I said, there are remedies, there are treatments available in almost every hospital. St. John's Hospital, we offer exclusive services for people living with sickle cell disease. And it is important that you follow the drugs, you follow the hydration procedures doctors have given you. You also eat well and also take care of yourself well.